Public health, they do restaurants and stuff, Department of Public Health.
I don't know. I'm not familiar with it. I couldn't really tell you.
I think public health is anything that would have to do with the public's well-being, as for epidemics and flu.
Well, it's the department that takes care of all the sicknesses or diseases.
No, I don't know. I say eating right and exercise. That'd be my best guess.
What is public health? A lot of people don't know the answer to that question. Many believe that public health just involves school kids getting shots or health care for the poor.
It might surprise you to learn that public health in Ohio touches all of our lives every day in many different ways.
In this program, we've put together a collection of stories involving real people just like you. People whose lives were touched by the public health system, some quietly, while others experienced a more dramatic effect in their lives.
This first story tells how the Ohio Department of Health and the Ohio Department of Natural Resources collaborated on the Ohio Raccoon Rabies Surveillance Project, a program that's been tracking the spread of raccoon rabies to the state and one family's encounter with this serious health threat.
I never really thought much about raccoons and rabies.
Rabies is a viral disease that is spread among all warm-blooded animals. And it eventually affects the nervous system where the animal will develop convulsions and eventually die.
We've been so used to seeing raccoons around here constantly and, upsetting the garbage cans, crawling out of the sewers.
At times the animal can be shedding the virus and spreading it, biting other animals before it's known that they actually have the disease, and that is the danger, of the spread, because an animal that appears apparently healthy can actually be infecting you with the deadly virus.
There have been a few that have come out during the day and gone up in various trees around here, but never once thought that an incident would happen like what happened in our backyard.
The significance of the raccoon strain rabies and the concern of the Ohio Department of Health about the spread of this in Ohio is the fact that there are so many raccoons, and because of raccoons are no longer hunted and because furs are out of vogue, the raccoon population is exploding, and it does particularly well in suburban areas. And the raccoons are in close contact with pets and also with humans, and so therefore there's a great potential to spread of the rabies directly to humans.
Our daughter Stephanie was upstairs listening to some music, and the neighbor, the far house Don here, called and said, "Stephanie, there's a little black dog in your backyard that's fighting with Daisy. It's on her back and all. You better go out there and break them up."
The Department of Health started a rabies survey program 2 years ago because of the rabies epidemic that has spread up the East Coast and through Pennsylvania over the last 20 years.
And Stephanie ran out the back door thinking she was just going to yell shoo, shoo, and so forth, and this dog, as she thought it was, would leave, when she noticed all these pools of all over in the backyard. She saw blood on Daisy, and this critter ran into the doghouse.
There's several different strains of rabies, and the bat and the skunk rabies are endemic in Ohio. But this is the first incidence of raccoon rabies that is thought to be the spread from the epidemic in the East Coast.
So Stephanie went by Daisy, and Daisy was whimpering. Stephanie pet her and grabbed her by the collar, stooped down and looked in the doghouse, and there was this raccoon backed in there snarling and going like this at her.
The importance of the surveillance to find out where the rabies epidemic is coming into Ohio is important, because then that enables the Department of Health to set up prevention measures and to make the population aware that there is a threat, and vaccinations can be done with the pets, which are what stops the spread from the wild population to the human population.
Stephanie immediately backed up and, oh no. So she unhooked Daisy, and the two of them ran and came in the garage here and shut the door. they cleaned our dog up and noticed a scratch or mark on her snout. We went up to the vets, and Dr. Reynolds checked her, and he made me feel at ease because I was quite concerned and frightened, and did talk about the possibilities of it could be, you know, the bad strain.
We had a call from the Department of Health first thing in the morning telling us it was positive. The Budays were notified. The dog, fortunately, had previously been vaccinated, and at that point it required only a booster vaccination, which simplified the whole process for the family. Because had it not been vaccinated, then that animal would be highly susceptible to the disease and would have to been quarantined for a long period of time to make sure that it didn't develop the disease. Rabies is a fatal disease that there is no treatment for, and if someone is bitten by a rabid animal and doesn't know about it, they eventually will die. If they are bitten, health departments require a series of vaccinations that can save your life, but these are extremely expensive, costing thousands of dollars. And so making the public aware of that and encouraging them to vaccinate their pets, which we have done by offering low-cost rabies vaccination clinics, helps prevent the disease.
Mary Allen, a certified nurse midwife, and others like her have received assistance from the Ohio Department of Health through the Primary Care and Rural Health Program to get their medical training and assistance. With this new knowledge, Mary and others are able to locate in neighborhoods where their help is needed. Mary returned to her former neighborhood in southeast Cleveland to give young women and old two things that are in short supply in their world: compassion and quality medical care.
I lived here for 20 years. I decided to become a midwife as a result of my own experience during my childbearing experience. I was 18 and an unwed pregnant teen, and just the care that I received was just abominable, the care that I received. There was no support for me, there was no support services, and I felt like I wanted to impact that at some point in my life. I wanted to change that. I wanted for, someone who would present to me in that position, I would be able to help them, unlike I was assisted during the course of my pregnancy and childbirth. Midwives are advanced practice nurses who have additional training. We're all registered nurses, and we provide care to women from menarche to menopause. Midwifery education is very expensive, and even though I was a registered nurse, it was necessary for me to work full-time because I pursued midwifery at a later time in my life where I'd already had family responsibilities, and without that assistance from the Ohio Department of Health through the National Public Health Service, I don't see any way that I could have achieved that mission. In this modern age, you would think, most people think that we still go to the homes and deliver the babies at home. But most of the midwives practicing currently in the state of Ohio, we all have admitting privileges to most of the acute care facilities within our district, and we often work hand in hand with the OB/GYN physicians. Most of us feel like we provide more personalized care to the childbearing family. We provide that support, that one-on-one support. We're usually with the laboring family throughout, from the first moment that they feel that they're in labor to the point that they deliver the baby, and sometimes up until 3 or 4 hours after they deliver, and we take care of that unit the whole time. A lot of people really don't understand how we fit in or why we exist at all. But all you would have to do is just ask some of our 16-year-olds who found themselves pregnant and didn't know what to do. I mean, I think we offer them that emotional support, that stability, that sense of oneness, that tells them that, okay, you're pregnant, okay, you made a mistake, and that's, we understand that, but we're going to help you through this process.
Scoliosis means a lateral curvature of the spine. For young children, it can begin a lifetime of health problems that injure the child physically as well as emotionally. Stephanie Klepper, a 9-year-old from Sandusky, already was experiencing difficulties from her scoliosis when a public health school nurse noticed her bent-over posture. Referring her to the Ohio Department of Health FCHS Specialty Clinic for Orthopedic Problems, Stephanie received the expert help she needed. Her parents also discovered another ODH program through the Bureau of Children with Medical Handicaps that helped to cover the expense of Stephanie's corrective surgery. The end results are amazing.
Oh, it was ugly. Her backbone was sitting up to her shoulder. It was, I don't know how she could walk around. Her back went up and it went way over to the right and come back right up back to where her neck belonged.
Well, at the time Stephanie presented to us, she had a 115-degree curve. In the projection that I'm referring to that number, the spine should be perfectly straight, 0 curvature. 115-degree curve is severe. Normally we recommend surgery at about 45 degrees, so she was almost 3 times the lower limits for surgery at the time we even saw her.
She didn't seem like it bothered her at all. She was up, played baseball every day and jumped around, roller skates. She never felt no pain or nothing. I know it had to be bothering her.
The problem that Stephanie faced at the time was that she is very small and very immature. If you fused the entire curve at that time, she would have ended up with a short trunk and then more normal length legs. And so she would have been somewhat disproportionate when she finally reached her full growth. So we've modified things to allow us to stabilize her curve, achieve a lot of correction, but also to allow her trunk to continue to grow for another 2 to 3 years. What we did is that we went through Stephanie's chest, we went through the side and we took out a rib. We went down to what is called the apex of the curve, which is basically the most severely curved portion, which is in the middle. We took out 4 disc spaces. That allowed us to get flexibility in her curve and also allowed us to achieve some translation of her curve at the same time. We put some little pieces of bone we ground up from her rib into those disc spaces. We then turned her over and we exposed the entire spine from the back. And then we put a very long rod in that allowed us to distract her spine and also to pull the curve over towards the midline to create or to achieve some correction at that point. And we were able to take her curve from 115 degrees down to 30 degrees. And she got about 3.5 inches of increased height immediately on the table because of the correction that we were able to give her. The quality of life will be that she will be taller, she'll be straighter, she won't have any visible deformity when she's dressed. Certainly when she's undressed, you're going to see the scars from what we have done. If she bends forward, you'll still see a slight rib hump, but she'll be well balanced, her trunk will be centered over her pelvis, and her legs will be in alignment. So I think that overall her prognosis for a fairly normal life is going to be quite high. I think the clinics have made a tremendous impact in the overall quality of health care for children in the state of Ohio. The one thing that I have found since I've been responsible for setting up 3 of the clinics myself is that the really severe child, we were seeing that child anyway in Cleveland. But there seemed to be another whole strata of patients beneath that severely involved child that were not being referred but weren't being treated locally either. And that's been the biggest help I think we've been able to offer these individuals, is to get into the community and offer our services to these children who basically were just kind of going through life and not being able to receive the full benefits of the health care that was available to them.
Seniors, the twilight years. Slow down, take it easy. Life of the senior citizen is sometimes viewed by society as rocking chairs, knitting, and the inability to get around. Yet some seniors don't subscribe to this view. They want to have fun, socialize, and at the same time get fit. Thanks to funding from the Ohio Department of Health and its Elder Health program, this group of Fairfield County seniors participating in the STAR program, Seniors Tackling Aging Responsibly, are learning to maintain mobility and reduce the risk of injury, while at the same time having fun. This is one group of seniors that won't take life sitting down, or will they?
Go slicing again, legs apart. Fight! Hands on hips, come on. Okay. Out.
have a 92-year-old lady that has been playing volleyball since we started the program.
How come you're not out there exercising right now?
It's too tame. You find me laying down on the floor and coming up.
Are you the person that gets to blow up the ball?
No, I don't have enough wind for that.
We receive $30,000 per grant year through the Elder Health Program to fund this.
What did you just tell me?
I can exercise all day and then dance all night.
To see the relationships forming between these different groups of people, it's been really rewarding for me personally.
To love me is to want me. We must be a hell of a man. Oh Lord, it's hard to be humble, but we're doing the best that we can.
The response to the chair volleyball in Fairfield County has really been overwhelming. We anticipated about between 4 and 6 teams, and the first year there were 10 teams. We currently have 14 teams, and many of the towns or the villages have at least two volleyball teams, so the response has been wonderful. They invited the junior high school students to come play with them as part of the life skills program that they teach over there. And the first game was very interesting because, you know, they're walking in with this cocky attitude, you know, this is going to be a real joke. And by the end of the game, they're yelling at each other because they weren't playing correctly and because the Amanda Astrostars senior group just beat the pants off of them.
This is before she, this is after.
And the seniors in this county are very aware of the connection between the Ohio Department of Health and their program. They have written letters of support to the Elder Health Program. They have volunteered to coach their time, so they have made a commitment as well to support this program.
So keep the program going, okay? Send that money down, okay? Good. Okay. We're number 1!
In the early part of this century, in fact until recently, coal mining has been a large industry employing thousands of people to dig the black fossil fuel from Ohio's southeastern hills. These miners worked long, hard, and dangerous hours, hundreds of feet beneath the Earth's surface. The men you're about to meet worked in some of those mines. The dangers they face today are not from the mines themselves, but from what went on so many years ago. You see, these men, like so many other miners employed to work in those dark and dusty mines, have contracted black lung disease that leaves them short of breath and robs them of the energy to get through life. Thanks to a program sponsored by the Ohio Department of Health, people with respiratory problems caused by industrial airborne irritants can get the therapy and health education necessary to make life a little more bearable.
I worked mostly out on what we would call the main haulage way, where there was a lot of dust, both coal and sand dust, silicosis dust. I was exposed to it all the time I was inside my working shifts.
We worked in all that dust with the coal dust and the asbestos and no paraphernalia to take care of the breathing part of it, because at that time they didn't say anything about it and never used any protective, you know, against it there.
We did not wear dust masks then. In fact, I don't think they even had dust masks then.
Black lung is a progressive disease, and black lung is not a medical term. However, that's the slang given to coal workers. It's the effect of being exposed to silica and inhaling that silica or the coal dust, and the disabling effects of having that accumulate in your lungs after a prolonged time. Our black lung program is sponsored by a federal state grant from the Ohio Department of Health, and the program is an open door policy. We've been an open door for coal miners for over 20 years, and what they do, if they have breathing problems and they know that they've worked in the coal industry or any other occupation where they have breathing, they can come here, they contact us, and the only criteria is that they have a shortness of breath or a cough or something. We treat them outpatient, we do pulmonary rehab, we do medical and diagnostic work, we do follow-up, we have a Better Breathing group that meets monthly to sponsor them, so that not only are they treated, but also we have strong follow-up and a networking program. If they need referral, We do that. We've been doing managed care at our facility and through our clinic for many years, long before it was really fashionable to do that. So when the minor comes in, we deal with if he has any benefits questions. If he doesn't have a family physician, we'll find him one. We also treat his disease and his disability. We teach them a lot of things about nutrition and breathing retraining and relaxation.
It's done for me long term. I imagine it's kept me going a little bit longer anyway, for quite a few years, more than probably if I didn't have it. And it makes you feel better. It does help a lot.
We like what we do, and it's we see positive results. It's not like occasionally helping someone and seeing an improvement occasionally. We make a difference in improving the quality of life. We work with our patients, and on the very first day of treatment, I talk to them about the mindset of remembering that their lungs have lung disease, but their arms and their legs and their mind don't, and that they shouldn't be afraid to exercise. And so we're introducing something, a whole new idea to them. They've been sitting at home in a chair, wasting away, becoming weak, becoming very sad and depressed often. We expose them to some positive ideas and improve their self-esteem, because we say, you, along with some support, can do these things you used to do, maybe at a slower pace, but we teach them how to conserve their energy and how to survive.
Phyllis Mary Jacobs climbs from the cab of an 18-wheeler and walks hand in hand with her new husband into the towpath truck stop in Coshocton County. Phyllis has a new marriage and a new outlook on life, thanks in part to a federally funded program administered by the Ohio Department of Health. Phyllis's outlook, however, wasn't always so rosy. A short time ago, she was diagnosed with breast cancer, and being without insurance at the time, didn't know where to turn. Coshocton County's Director of Public Health Nursing, Beiter, explains the program that helped Phyllis and other women like her receive life-saving medical care.
The Breast and Cervical Cancer Project started in 1993 when the federal government allotted some monies for early detection programs for breast and cervical cancer. Since the program started, we have seen approximately 49 women. The numbers initially were low because of lack of awareness of this project, but it has been steadily growing since that time, and the number of ladies we're seeing each month has practically doubled.
I was driving a taxi. I didn't have no insurance, no hospitalization or nothing, so I didn't know what to do.
Jacobs was referred to our program through the mammography center at our local hospital. She had gone to them because she had felt a lump in her breast. She wanted to have further screening done and was concerned about her financial status. One of the barriers to women like Phyllis as far as receiving early screening for breast and cervical cancer is the lack of financial resources. This program has greatly helped with that. The other barrier would be just the lack of awareness that these programs or this program is out there.
There was a girl yesterday that I met and that I know, and she's got a big lump under her arm. And I told her she has no insurance. I told her to go talk to Becky.
Through this project, they have become aware that they do need to have screenings more often, and that we are there, to make sure that they don't forget. We make sure that they get the follow-up needed, and this program has been instrumental in that.
If you don't have anything, there is programs out there for people like I was.
I feel that the early detection programs are the key to helping these ladies to lower the incidence of mortality with breast cancer. After her surgery, Phyllis has been very frequently visiting our office to receive support and follow up to make sure that she is getting along okay. During that time, I guess I have had the opportunity to get to know her on a more personal basis, and I find her to be just a real wonderful individual. She has had to cope with a serious illness and financial burdens. She's also had some major life changes in the past year. She has remarried, which sometimes those issues can be difficult for a lady who has had a mastectomy.
And I still keep in touch with Becky. I still go out and talk with her.
She continues to come back to our clinic. We look at the clinical nature of it, but also the emotional and the personal side. She's looked upon as a friend here as much as a patient.
Electricity is something we often take for granted. Without it, our lives would be very different. The 20th century has seen technological wonders abound, one of those being the advent of nuclear power. Coexisting along with the promise of plentiful power, awesome responsibilities exist to make sure nuclear power plants are kept safe and that the system used to generate electricity doesn't become a toxic nightmare. Port Clinton is a small town that exists literally in the shadow of the great cooling tower of the Davis-Besse nuclear power plant. The people who live in this picturesque little resort town seem unconcerned with the potential problems that could possibly stem from a nuclear facility. This is due in part to an environmental monitoring program that is funded by the Ohio Department of Health and administered by the Ottawa County Health Department.
I don't think with the wildlife around there that if there is anything out there that it's going to be anything that's going to expose me to a certain level or it's going to affect me greatly. I mean, anything gives off radiation. People give off radiation.
You might be surprised that the people who live in the area of the nuclear power station don't have a lot of concern for its safety. There is a great deal of comfort and trust that the power station is operating within the law. The purpose of the whole monitoring program for the Davis-Besse nuclear power station is to assure that there's been no release of nuclear particulates.
Every Tuesday morning, I'll meet personnel from Davis-Besse at the Port Clinton Waterworks, and we'll take a 2-quart water sample, and from there go to Portage Elementary.
The sites are selected for sampling in an arrangement between the nuclear power station, the NRC, and the Ohio Department of Health. We do conduct a split sampling program with particularly water and fruits and vegetables, fish, and sediments. So that means when we collect the sample, we do it jointly. We divide the sample into 2 containers. The nuclear power station sampling team takes 1/2 the sample, and the other half we take and we either composite or send directly to the Ohio Department of Health laboratories.
At approximately 9 o'clock, I meet Steve or someone from Davis-Besse Nuclear Power Facility, meet him at the Toussaint River, and we take a water sample, usually 2 quarts, at the mouth of the river.
We receive about $9,000 a year. That provides all of the support for the monitoring program. We do very minimal sampling, so I believe that the amount of sampling we do is just enough to assure public safety, yet not being overboard by doing far more than we even need to prove that the power station is operating within its parameters. I think the involvement of a local health department staff providing the sampling program there are several aspects to that. One is that we are very familiar with the area and the nuclear power station. We live in this community and we understand the value of the sampling program and the protection of the citizens that we provide to the citizens that's provided through the sampling program, and are here on an everyday basis to answer any questions. I think it makes a great working relationship for the Ohio Department of Health, the local health department, the Ottawa County Health Department, and the nuclear power plant, Davis-Besse Nuclear Power Station.
Laboratory tests are generally impersonal, clinical, and not where you'd expect to find a heartwarming story about caring and relationships. However, at the Ohio Department of Health laboratories in Columbus, such a story came out of a routine blood testing program where newborns are screened against metabolic disorders.
My name is Jeffrey William Lindquist. I go to school at Ridgeberry and I'm 8.5 years old.
Jeff is our only child. We had him kind of late. You know, we're older parents. I was 35 when I had Jeff. He's very special for us because of that and because of the fact that we lost 2 children after we had 2 miscarriages.
Jeffrey was born in 1988 at Marymount Hospital, where they did some tests on him and found that he had a deficiency of a hormone for his thyroid. And we were very impressed by the hospital staff by checking him several times to double check to make sure that there indeed was a problem. And we understood later that the state initiated these tests for babies to find out whether they have such a problem. Even though it's quite rare, still, in our case, it was certainly worthwhile.
Jeff has one of the diseases called hypothyroidism. Without the screening that we do and the treatment, he would be severely, terribly retarded and probably a ward of the state and an institution for life.
We were very impressed by the way that the state did the test. We understand that not all states do this testing. And this was really amazing to us that this is the case. And we're so fortunate that being in Ohio that they think about these sort of things.
I was hoping when we went down for the test to Rainbow that it would be a false positive and that this wouldn't be. But when they confirmed it, and when I thought about it, I thought, well, how fortunate we were that they found it and that he's completely normal just by taking 1 pill a day. Jeff was seeing a pediatric endocrinologist at Rainbow Babies and Children's, and I asked her how I could get in touch with the state because we were so grateful for their discovery. And she gave me the address and the name. And I wrote to Mr. Little just to say thank you and to let him see the result of their work. It's so difficult to sit in a lab and do test after test, and we thought for him to see a real life example of a success would be great. And we also wanted him to know how much we appreciated the work that they do.
We like to think about that there's actually a baby on the other end of each one of the blood cards that we get, and it's not just a piece of paper. When Mrs. Lindquist sent me pictures and a letter thanking me, it brings it all back that we really are dealing with patients and not just little slips of paper with blood on it. And it's really rewarding for us. That's one of the very few rewards we get and feedback that we get. I've only corresponded with 2 or 3 other families over the years, and nobody for as long a time as the Lindquists.
Metabolic screening is so important. I mean, it's made such a difference in our lives that I just can't imagine why, if all states don't do it, that they should. His doctor told me that a lot of children that she saw in institutions 14, 15 years ago didn't need to be there because this test wasn't done. So we are so grateful that they uncovered this problem. It's just made a world of difference for him. And that's why we continue to correspond with the state, because we want them to know that.
We hope you have enjoyed this program and that it left you with a better sense of what public health is all about.
Public health is a broad range of services and philosophies that are ever-changing, ever-growing.
Look around in your own communities and see what new awareness how public health affects your life. Maybe you too can find a way to help to contribute to this wonderful thing called public health and make a positive difference for those in your community.